Hello, I'm Bridget Mayfield and I'm interviewing Diane Cessna. She's been an RN at Cottage Hospital for about 35 years, and I'll let her give her experience at Cottage, a little background on where all she's worked.
Hi, my name's Diane and I've been a nurse at Cottage Hospital for 35 years. Initially, my husband and I came to this area and we thought we'd probably be here a couple years and then probably move back to where we were from. However, then we just kind of got working full-time, and then we had some kids, and then we didn't want to take them out of school, and we just ended up staying in this community for this number of years. I was in the float pool at Cottage for 12 years, and I worked initially in the on the floor nighttime for just a year, and then I came to days. And then I worked in the ICU and the recovery room for a long time, just as one of the people in the float pool when they needed extra help up there. And most recently, I've been, probably for about the last 10 years, I've been on 2-med-surg, which is the medical surgical floor, and I work days there. And honestly, I kind of like that better because I kind of know who I'm working with, and a lot of times I have a lot of the same patients. I work several days in a row, and with a lot of time off, I just work part-time.
Okay. Well, what we're going to talk about today all revolves around mandatory overtime issues, and I wanted to get kind of your personal take on how it's affected different parts of your life and different elements of how you go about being a nurse. So my first question is, when working mandatory overtime, how did it affect your professional performance at your job?
That happened several years ago when we were told that no one would be leaving the floor until someone signed up to work on overtime, and it affected your performance in that if you had had an awful day or a long day with some trying patients, the thought of having them for 4 more hours was just about more than you could stand. Emotionally, you were upset because you were just being told what to do. You felt that you were powerless and didn't have any say in the situation. You also worried about your coworkers because you knew that a lot of them at home had younger children and they needed to be home with them, and you didn't really have a good excuse except for the fact that you didn't want to do it. If your spouse was not supportive of the fact that you had to stay, then you had to face that when you got home, and them trying to fix everything that was wrong, and all you wanted them to do was listen and not necessarily fix it. It wasn't a very good situation. I would say, yeah, it pretty much got you upset for several days at a time.
Do you, in your experience, did it usually include, if you worked an 8 or a 12-hour shift, it usually was tacking on another 4-hour before someone would be able to come in and cover?
My experience was I was always scheduled for 8 hours, and the extra time was always that 4-hour shift that they thought anybody would be capable of doing. However, if you worked day shift, it included 3 meals for the patients and most of the medications for the day, and sometimes it was just overwhelming. You might have a couple of St. Mary's Square patients who needed feedings via a feeding tube, confused patients that you had to continually keep track of, and I guess I never really got the low acuity patients that were easy to handle. At least they never asked me to stay on those days. I would have gladly taken that assignment.
My next question is, when working mandatory overtime, how did it affect your home life? Because you had 2 children, within a couple years of each other. So during that time period in your life, in your husband's life, how did it affect your home life with your kids and other extended family obligations?
When Cottage was having the nursing shortage, that was just probably within the last, I would say, 10 years. My kids were born in 79 and 81, so they were old enough that they didn't need me at home. But at the same time, maybe they needed some supervision, or my problem was, like, they would be very involved in their sports at school, and if you had plans to be going to the games or other activities, you had to change at the last minute. And again, the spouse didn't like it because you had all this planned out and it was changed at the last minute. Yeah, not conducive to a good home life, and that was always important to me. So.
Um, do you think hospitals follow the actual mandatory overtime laws that are in place now, where they can't actually force you to work shifts beyond what you've already signed up for in your bid? Do you think that they actually adhere to those policies?
Um, at Cottage, I would say that I feel that like I can say no if they ask me to work overtime. A lot of time it's all in the approach that's used, because say 5 years ago when we were asked to stay, we were more or less commanded that no one would be leaving until someone signed up to work extra, while that warm body was there to fill that space. Now they start out earlier in the shift and they ask you. They use a much better approach. If I know what kind of assignment I have for the day and it isn't too hectic and I'm not tearing my hair out, I'll be glad to stay and help them. But sometimes it just is all in the way it's presented to you. Right now I could say yes or no, and I don't feel like there's any repercussions about what I choose to do. I can't say like 5 to 10 years ago that was the way, because it was pretty much expected that yeah, everybody was going to work an extra shift whether you wanted to or not, even the people that work full-time. It was just wrong.
Okay. In their tactics now, what do you think has been the most successful way they get around the shortage that because there's always seems to be a shortage, and they are always seeming to scramble to find people to fill shifts. How do you think that they've changed? What's the best way they've changed, I guess, is my question.
I think the best way that they've changed is the way that they approach us, because before they just acted like it was a body that needed to fill a spot. Now they actually act more respectful towards you. They understand if you have other commitments. They don't really high pressure you like they did before. They ask you once and you respond, and they seem to accept it better. I do think they are genuinely trying harder. One thing that Cottage needs is more people in the PRN pool to come in, because we have very few of those. And honestly, to get some time off, you really have to work and call and make your own substitutions. If you want a vacation, it's just about unheard of if you don't practically fill your own spots, because there's not enough people to fill those. Sometimes if you have good friends that you work with and they know that you want off, they're pretty willing to help you.
So when you have a good unit of people working together, it seems to you coordinate schedules and help each other out. So that's
right. And if they know it's genuinely a good reason that you need off, people will actually call you to say, I understand you need some time off. I thought about maybe putting a sign up on the wall. Some people have responded to that in the past about if you need time off. I just had a new grandbaby born, and I needed to go to Des Moines, and I was able to get somebody to work for me 4 days, and that gave me a long time off, so I didn't have to travel back and forth, and that really helped. And you appreciate those things, and you're willing to do it for the other people too.
Okay. Do you feel in the past, was overtime pay ever a distinct motivating factor to get people to not be so negative about having to work mandatory overtime, or was that not something that was helpful?
I think when they offer an incentive to work overtime, it should almost be something that you expect that you will be paid more. You're being inconvenienced, you're being helpful. Sometimes if they aren't willing to come across with a little extra money, maybe that means that I'm not willing to work. I just kind of think there should be a happy medium, give and take, and if you realize that you're helping them out, they should be willing to give you some type of incentive. Yeah, I think good working relationships are important, and that extra money is very nice and makes it much easier to say yes to those extra shifts.
Okay. In your experience, have you ever known of anybody, or has it ever happened to you that the requirements to work more than what you felt was correct in your life situation at the time, whatever bid you were fulfilling, did did you ever experience personally or know anybody that ended up leaving the nursing profession, or negative consequences came across their career in nursing?
Because of the amount of time they were expected to work? I've known some people that left, but they mostly said that it was mostly peds related, I guess, and the situation that occurred there, because there weren't enough pediatric patients. They would have to float out. They didn't like that. They were there to be a peds nurse, and there weren't that many available pediatric patients. Sometimes, you know, people just move on. They move to a different area. Galesburg offers some things to some people, but some people need more action than this community can provide. If you were young and unmarried, you know, you probably would need to maybe go someplace that had a little bit more happening than around here, and that's how some of the nurses maybe look at it too. At Cottage, we have a lot of long-term people that have worked there like 20 years and above, and then we have like people who have worked there less than 5 years, but that's like 5 to 20 years. If you're going to leave, you leave before 5 years, and if you're going to stay, you stay for the duration of your career probably. So there's a lot of people that enjoy working there. We're friends and get along good, and we help each other, and it's good to have those people helping you.
Okay. Well, I really appreciate you taking your time to talk to me today. You're a good friend. And that's all I have to ask her today. I really appreciate your time.